Inclisiran is a small, interfering, double-stranded RNA. It harnesses the body's natural processes of RNA interference, a Nobel Prize-winning discovery. It specifically goes to the liver. Inside the hepatocyte, it breaks down messenger RNA and inhibits the production of PCSK9, which is a validated target for lowering LDL cholesterol and for reducing cardiovascular risk. The pooled analysis of the ORION Phase 3 trials examined patients who have atherosclerosis, whose LDL cholesterol was 1.8 or higher, despite being on maximally tolerated statin therapy. Patients were excluded if they were already on or planning to be on a PCSK9 inhibitor, had class 4 heart failure, or a recent major cardiovascular event. Patients were randomized to a subcutaneous injection of inclisiran versus placebo for 18 months. So patients received an injection at day 1 and day 90, and then every 6 months thereafter until day 540. The study had two co-primary endpoints: change in LDL cholesterol and the time average reduction in LDL cholesterol. Exploratory endpoints of major adverse cardiovascular events was also considered. Over 3,660 patients were randomized to receive either placebo or inclisiran. Almost all patients completed the study. The baseline characteristics were typical of what we see in most lipid or cardiovascular trials. The average age was just over 65, with approximately 30% of women. The baseline LDL was about 2.9, and all patients were either on a statin or ezetimibe. Compared to placebo, inclisiran lowered LDL by 55% at day 510. The time average reduction of LDL from day 90 to 540 was just over 50%. Both of these co-primary endpoints were highly statistically significant. So how effective was inclisiran in getting patients to their target LDL? 76% of patients receiving inclisiran reached a target LDL below 1.8, and 58% reached an LDL target less than 1.3. Inclisiran also significantly reduced PCSK9 levels, total cholesterol, non-HDL, ApoB, and Lp(a). Other than injection site reactions, there was no significant difference in terms of adverse events or safety events between patients who received inclisiran versus placebo. Pre-specified exploratory cardiovascular endpoints appear to occur less in the inclisiran group. In conclusion, inclisiran is a novel approach to reducing LDL. With only twice-yearly administration, it provided robust and durable LDL reduction over 18 months with an excellent safety profile. The effects were consistent in patients with heterozygous FH, established atherosclerotic cardiovascular disease, or atherosclerotic cardiovascular disease risk equivalents.